So today I want to talk about Dr. Hassan Gokal. Dr. Gokal is a medical doctor from Texas who's responsible for saving a number of dosages of the coronavirus vaccine from going to waste and expiring. He was at a distribution center and was distributing the vaccine, and one of the vials that had been opened still had 10 remaining dosages, and he had 6 hours left to distribute these remaining dosages. And for doing this and actually managing to find arms for the dosages to go into, he had his life turned upside down. He was fired and charged with theft of that particular vaccine and he lost his job. So, with that said, I want to cover what Dr. Gokal experienced from a number of different ways. First, I want to briefly discuss how the US under modern capitalism is wasteful and is not used to things being in short supply. Then I want to share Dr. Gokal's actual experience and what transpired, and why I believe he did nothing wrong. Next, I want to call into account the racism that Dr. Gokal experienced, given, everything that transpired. And then I want to talk about the fact that corporations have done and made very similar decisions in terms of who they are able to give the vaccine to with little to no repercussions. In fact, they've been kind of praised for it. So I want to talk about that double standard. So starting off, first and foremost, modern capitalism in the United States is not used to having to ration or manage a limited supply of anything. The US is wasteful. As a model, we overproduce everything, and we always have extra. So, in terms of the society, it's not really surprising to hear that technology is consistently replaced instead of repaired, and food is wasted all the time. It's not uncommon to find dumpsters full of prepackaged food, and in some places, it's also not uncommon to hear about stores pouring bleach over food to destroy it to make sure people don't go into said dumpsters to grab them. This is a society that overproduces and wastes all the time. Furthermore, the distribution of the vaccine has been horrendous, not just in the US, but worldwide, due to a lack of supply, and there's a number of reasons for that. But given the US's situation and the fact that it's not prepared to deal with not having, we don't have procedures, we don't have protocols for rationing. It's quite apparent that wait lists and other systems that are being done on this case-by-case basis are just not working, and we're not equipped, we don't have the technological infrastructure for something like this in terms of handling these extra dosages in the vials of vaccines. We don't have a system in place, we don't have protocols, and there's no set standard across the United States. Everything is being handled on a case-by-case basis. Now, all of those issues could be topics pretty much in their own right for videos, but I just wanted to draw a general reality and experience of what the US already looks like going into something like what Dr. Gokal's experience was. So with that said, what actually happened in Dr. Gokal's experience when he had to deliver these dosages of vaccine? So, Dr. Gokal is a 48-year-old immigrant who immigrated from Pakistan as a young boy. He has a medical degree from SUNY, Upstate Medical University in Syracuse, and has worked in hospitals in central New York. He moved to Texas in 2009 to oversee the emergency department at a suburban Houston hospital. His volunteer work has included rebuilding homes and providing medical care after Hurricane Harvey in 2017. This does not strike me as someone that, just from his credentials, seems like someone who's a malicious or bad actor in any of this. And I think that that's something we should take into account. So, this is a picture of Dr. Gokal. Fortunately, he was, when the coronavirus started becoming an issue last April, he was given a job at Harris County Public Health Department to become the medical director for the COVID response team. You don't make someone medical director if you don't trust them on some level. He had a lot of issues finding employment at that time because he was in a place where he was petrified to go home because his wife is someone who's at risk for the coronavirus. So the Harris County Public Health Department recruited him, and that's where he got the job that he was at up until recently. So at 6:45 at night on December 29th, he was at an event where people were being administered the vaccine. And once you open a vial, again, you have a 6-hour time limit to give away all the dosages. Now, he discovered that there would be unlikely to be more people arriving at the event. And so he tried to rush out and tried to get anybody in the area to take the vaccine, whether it be other medical professionals on hand, other workers that were there, some police officers that were on the scene. And he realized that he can't get this back to his office without the vaccine going off. So he called the Harris County public health official in charge of operations and said that he planned to find 10 people to give the remaining dosages to. He was simply told, okay. Seems reasonable enough at this point. So he went into his phone and tried to find contacts of older relatives and neighbors of people that he knew that would be good candidates for immunization. And he said, no one I was really intimately familiar with. I wasn't that close to anyone. And so when he did this, he went back to his home, and outside of his home were 2 people. A woman in her mid-60s with cardiac issues and a woman in her early 70s with assorted health problems. Both were inoculated. Great. So he gets back in his car, and his wife goes with him to another place where there's 4 more eligible people. A man in his late 60s with health issues, the man's bed-bound mother, who's in her 90s, his mother-in-law, and her mid-80s, in her mid-80s rather, with severe dementia, and his wife, and her mother's caregiver. So this is a family of 4, and all of these people make sense to get the vaccine. He then drove to another home. A housebound woman in her late 70s got the vaccine, someone he didn't know at all. And the last 3 dosages remained, and 2 people arrived on the scene. A distant acquaintance in her mid-50s who works at a health clinic's front desk, and a 40-ish woman who he had never met, whose child relies on a ventilator. And again, if you have a child who's on a ventilator, that might be someone who you don't want to get the virus, because maybe you could spread it to the child if that happens. So none of these people seem to be poor candidates for the vaccine. Are they all optimal decisions? Maybe not, but you had a time restraint and you had 10 dosages that had to go in people's arms. So now we're down to the last dose. The last person that was available couldn't make it. So he actually gave it to his wife, who has pulmonary sarcoidosis. So this makes her eligible for the vaccine, but he didn't want to give it to her for obvious reasons because that's nepotism, right? Like that's legit giving that. But it's the last dosage. There were 15 minutes remaining on the time limit, and he gave her the vaccine. I don't think him giving that to her is irresponsible in that case. He did his due diligence to make sure that all 10 of those dosages were taken into account. And I just want to put it out there that when he first got the job, one of the things that he had been told was to make sure that you utilize as many of the dosages as possible, that none of this supply should go to waste. So he did his due diligence and he followed through responsibly. The response to this? He was promptly fired. One of the officials started questioning him when he came in to the office, and it was talked about whether or not what he should have done with it. he was asked about the, quote, equity of the dosages distributed. Now, he then proceeded to ask, are you suggesting that there were too many Indian names in that group? Exactly. He said he was told. So he was accused of distributing this vaccine in an irresponsible and inequitable way for finding people in his contact list, which he was told to do and was told was okay, because those are the people he was able to get access to. To make matters worse, in a number of weeks, a report came out that he was being charged with having stolen the vial and that he had disregarded county protocols to ensure that vaccines are not wasted and administered to eligible people on a waiting list. Now, this is absolutely ridiculous, and the criminal court case dismissed it completely. There was no probable cause involved. The issue is that Dr. Gokal is now having a situation where hospitals have told him not to come back until his case is resolved. In the meantime, he spends his time volunteering at a nonprofit health clinic for the uninsured, haunted all the while by the realization that no matter what, it'll still be out there. The story about a Pakistani doctor in Houston who stole all those vaccines. Now, it's quite apparent to me that the health officials had no actual protocol in place, that there was no apparent and readily available waitlist for Dr. Gokal to consult. So he did the best he could in the moment. He tried to find people on the scene to distribute the vaccine to, he reached out to other officials, and he got the okay from the county health official. So he did what he could. He took the vial home with him and he distributed it as he could to people that he drove to their homes for. He didn't just hand it out to people, he drove to people's homes. 2 of the people at least were bedridden and might not have otherwise been able to get access to the vaccine. So I think given all of that and given his history, he's someone that we should really be giving the benefit of the doubt to. And I have to call into question why he is being criticized for being inequitable with the dosages because of the number of Indian names on that list. And I think the county officials are at best being disingenuous and at worst are being extremely racist. Now, I call this into account because the idea that he stole this, the idea that he took this vial and would distribute it specifically to his community and take it, is absurd in its own right given his history. But we've had cases across the country where, like in Seattle, where you had a freezer full of 1,600 dosages, where they had to literally rush out and get people in to make sure that the vaccine was distributed properly. You had a situation in Oregon, in Josephine County, where there was a bunch of vaccines stuck in a rural area on the side of the road, and they just had to give it to whoever was in the cars nearby. These situations have happened, and I have to ask why it is that nobody in these particular situations were treated poorly and were fired and nothing went wrong, but the Pakistani doctor who happens to give it to people who are from the Indian subcontinent is an issue. And I also don't think it's absurd that someone who has an immigrant background, who is, who has ties to Pakistan, might have people of a similar cultural background in their contact list. And there's a number of reasons for that. That could be tied, and I can't speak to Dr. Gokal's specific reasons for it, but it could just be that he's in an area where the grocery store that, has his cultural food is, and these are his neighbors. It could be religion. It could be any number of other reasons. This happens and is well documented that immigrant communities tend to form around each other. And so I don't think it's absurd to think that his contact list was filled with people, and he wasn't even sitting there thinking, well, who's in my contact list? He was sitting there thinking, who can I get this vaccine to? Which arms can I get this into? These are the people that I have in my contact list. And he even said he's not even familiar with most of the people in that contact list on an intimate level, that they're all basically acquaintances. So this just strikes me as something extremely racist from the community to impose on him. And I just really have to call into question whether or not, if he was a white doctor administering this to white patients, if he would have been called into question. And now that I've posed it, like, I don't know, I'm not in the heads of the health officials. But it doesn't make sense in that kind of crisis situation that if somebody did and seems to have acted in the best faith possible, to call that into account and criticize that, because it hasn't been done in other cases. And as a matter of fact, when corporations have been put in quite the same place, when places like Walmart and CVS have been responsible for handing dosages out, they've been given the free leeway and reign to give it to their own employees or to the public at their discretion. And so CVS and Walgreens, the two biggest retail providers of vaccines, say that they've been vaccinating employees in small numbers with leftover dosages that are set to expire and plan to continue as they vaccinate more broadly. Drugstore employees already qualify for the vaccine under some state guidelines because they're considered healthcare or frontline workers. But companies say leftover dosages in many cases can also go to workers who wouldn't otherwise qualify, such as cashiers. And I think that's worth talking about, because the idea that a company who benefits from their employees being inoculated, giving it primarily to their employees, and I'm not saying the employees don't deserve to get the vaccines, but the idea that they could give it to their cashiers, which benefits them in terms of not having to worry about as many sick employees and so many other reasons that we could just sit here and compound and put out there, strikes me as odd, and doesn't strike me as a form of cronyism, and doesn't strike me as a form of nepotism that benefits the company as a whole. But a person reaching out to their own community, a person reaching out to the people in their contact list, a single doctor who doesn't have protocols and wait list from health officials, is being charged with doing something inequitable and wrong and stealing, strikes me as absolutely bizarre. And that is something that will follow him, unfortunately. Like he said at the end, there will always be that looming story of the Pakistani doctor in Houston who stole the vaccines. Whether or not he did or not, which he didn't, it's very clear to me he didn't. Whether or not, he even is responsible in that particular way, that level of racism, that level of story and narrative will follow him. And I think that's irresponsible. And I think that's horrendous, given that he's someone who literally just thought about preserving a vaccine in a country that already, doesn't know how to handle this type of rationing situation. He did the best he could, in my opinion. And I think he's someone that should be commended, not fired. With that said, if you like this video, give it a thumbs up, hit the subscribe button and bell for notifications. You can follow me on Twitter and check out my Discord in the description down below. My name is Anarchist Tara, and I hope you enjoyed watching.